There was a time when, so going into my preceptorship, something that I really wanted to work on was IVs because I just sort of had this like fear of IVs since I had never got to practice one. I never had the opportunity to try one in a clinical rotation before. So we had a patient who was a patient come in and they were like, "Oh, like this is an opportunity for you to be the one to start the IV." So I had my chance and I completely ruined it. It did not go well. But my preceptor was watching me do it, and then after the whole admit was over, she pulled me aside and was like, offered me some feedback on what parts I needed to work on, and she noticed that I really needed help with a mechanical action of inserting the IV. So she made me this little model out of tubing and a cloth of a fake vein I could practice on. And basically, after she offered me that feedback and made me that little model, I took every piece of free time I had to practice it. And then I went around the unit for the remainder of my shifts asking the nurses if I could practice doing IVs for them and help them out. And everyone was very willing to teach me and let me use that advice that I had been given to work on my IVs. And I did eventually get them on my own, and it was very exciting. But what I learned from this was that it's very important when you're doing something that you need to work on or that I'm not very skilled in yet, that I'm open to receiving that feedback because she really pointed out what I needed to do. And I sought out the opportunities to get better at doing that thing. And I think that it just showed that taking initiative and being willing to learn, especially as a new grad, I'm going to be needing to learn so much, is very important in boosting my confidence and my experience and making my skill set stronger.
Okay. And maybe you can even say something about whenever anyone gives you any feedback, you make sure they only have to tell you things one time, because you really appreciate it so much. You just kind of sponge it up and incorporate
Mhm.
it and build that into your practice.
Yeah, I like that.
There was one thing I wrote down.
Absolutely.
Oh yeah, I wrote down don't laugh. Um, so when you
Okay.
were saying that you completely ruined it, you kind of giggled, and I think it might have been an effort to like build rapport with the interviewer. I just,
hmm
as someone who's missed IVs, the patients are always
Yeah,
like not happy about
yeah,
it.
that's true. That's true. That's true. Okay.
So I would kind of make it more like I just wouldn't
Recognize
make
that it's a
light of
serious.
that. Like I know you're
Okay.
kind of trying to like not what's the word? Like not take yourself too seriously type of thing.
Yeah.
But just keep in mind you're talking about someone who just got like a needle put into them
Yeah, definitely.
unsuccessfully, you know what I mean? I just want you to have the safe bet so that there's no like wiggle room
Definitely.
to misinterpret
hmm
you, you know what I mean?
Absolutely. Yeah.
Yeah. Um,
Uh,
you're making this too easy for me. Um,
Thank you. It's been really helpful having the journal because I literally have just been walking through every potential question and matching it with the stories that I have.
awesome.
And the Notion template was another thing that I actually used a lot because like I just went through and like in small chunks covered every one of those questions.
A time that I received constructive criticism was from one of my instructors during a clinical rotation. We had been practicing head to toe assessments, and it was my turn to get checked off for my head to toe assessment. And after I completed it, my instructor let me know that it would be better if I completed it in more of a systematic manner. She said, if you're not doing it systematically, it's very likely that you're going to leave something out, you're going to forget something, you're going to have to go back into the patient's room, and it can just really mess up your time management, especially if you're having a busy shift. So after I received this feedback, I thanked her for that, and I made it a point to start completing as many head to toe assessments as I could on my future clinical rotations. So I really got that down, really honed in on my assessments, and I now feel very confident on them. I think they're thorough, but they're also timely. And I just really appreciated getting feedback from someone that has more knowledge than me. I like when people can give me these tips and tricks because I feel like it makes my life easier, and I just enjoy getting that feedback.
I like it. I know I said that it makes your life easier. I feel like that might be a little bit too casual for like an interviewer. Maybe just say it's incredibly helpful or whatever, like some professionalized version of that. A time you got feedback or a time you got constructive criticism, and it's more about the points are for if you're receptive to feedback. So you basically talk about, I mean, it's easier if it's about a skill than about like a personality trait kind of thing. You just talk about something that you kind of sucked at, and then someone gave you the super helpful trick to use or tip or whatever, and then talk about how much more confident you were after practicing with that and how much you love when people are willing to, especially if they have years of experience, to just give you
Yeah.
that advice. What if there was a skill that everyone kind of struggles with that you were struggling with, like IV angle insert, like IV insertion, or like
Yeah.
the perfect drop of blood for a blood sugar? For me, it was I could not figure out the roller clamp. Like I would always do it wrong. Like
Okay.
something where it was they were like, "Hey, if you do it this way, it's gonna go so much smoother for you." And then you practice with it.
Okay. I have two. I have one that's like I couldn't get my an IV in. I also have another one where it was so hard for me to remember the EKG leads, and when it was important time to actually do it in such a fast pace because we were expecting a potential MI, I just couldn't perform the leads at the right time, and I think my nurse like, wasn't really too
Maybe
happy.
talk about the I think the IV is gonna be a better one for you.
Okay. Okay.
Oh, so how's that one go?
Yeah, so I had a patient that came into the and we had to start an IV. And at this point in time, it was like my second or third time ever starting an IV. So I noticed that when I wanted to start the IV, I went into the patient's vein, and when I had applied the tourniquet, I saw a vein that I thought was going to be good enough to insert the IV. But when I inserted it, I met like kind of like a hard resistance. And when I thought I had gotten flashback, I didn't further the catheter in, and I lost the blood flow return. And at that point, like I noticed that the patient wasn't really feeling comfortable after that. So then I had asked the nurse if that the nurse had pulled me aside and said she'll take over this one. And I think afterwards, I went up to the nurse and I was like, can you like teach me how to like insert an IV correctly the next time? And she told me that I wasn't angling it down enough. I was more doing it perpendicularly. So she said I had to like lower it down to like a 10-15 degree angle for me to like slide in the catheter and further advance it. So from there, like I had asked her if I could be in the triage room for like the remainder of the shift and like practice more IVs. And to be honest, eventually like, I got good at it. Like, I was able to start like 40 IVs for the rest of the shift. And I think her just guiding me through it and just practicing it like visually, I was able to grasp that concept better.
You say 40 IVs?
Yeah, it was like community hospital. It was a community hospital. So like it was a lot of patients that come in and out. So like our
Wow,
waiting room was really big. We had like 4 trauma bays, so it was really big.
that's crazy.
Yeah.
Okay, I like that. You get to like come out the other side confident and like confident in the skill, you know what I mean?
Okay.
And
Yeah.
it shows that you were super receptive to feedback and you took what she said and practiced with it and took it to heart and got better. Yeah, the points for this are usually something about being receptive to feedback. So say something at the end that basically says, without saying, I am receptive to feedback.
So it was like overall at the end of it, I just really appreciated the tips that she given me because those tips have allowed me to further furnish my IV skills for
Yeah, or to, to become really much more confident with
IVs.
skills. Yeah. If you find these videos helpful and you want to grab your own list of nursing interview questions, over the years I've collected every question that any new grad has told me they've been asked in their new grad nursing interview, and I've compiled it into a 22-page, 72 question PDF that you can download. It's $5, but with your discount code, you can get it for $3. So your discount code will be just YouTube. So I'll put the link in the description below. Go ahead and check that out if that's something that you think would be helpful. The idea is hopefully you'll encounter any questions that they're likely to ask you to help minimize any surprises during your actual interview.